This is a bump. Okay, it's the very tip, the apex, okay, of the renal pyramid. Just this little nip at the end, okay? So we have renal pyramid, renal papilla, renal calyx, renal pelvis, ureter, renal cortex, yes, renal medulla in the middle, renal artery, renal vein. Okay. The renal column is the space in between the pyramids is a renal column. Okay, so you see there's a region in between here and here, in between the renal pyramids. That's a renal column. Okay? Any space in between two pyramids. Pick a space, and that's a renal column. Okay? On this particular model, it's easy to see it on the renal pyramids that have been cross-sectioned. You can see it a lot easier than you can see here. It's this kind of space tucked in between. Okay. The renal cortex, as I said, is the outer region. The renal medulla, closer to the renal pelvis, the inner region of the kidney. Okay? So you have pyramid, column, papilla, renal cortex, renal medulla, this region, renal calyx, renal pelvis, ureter to the bladder, okay? This is renal artery, renal vein. Whole thing is the kidney, okay? This region's the hilus. Okay. Now we can look at the nephron, okay? Now, these color codings, see how every single section of it is a slightly different color. So I'm going to give you the color coding for this model. And you should write on your list, purple, red, pale green, okay? Because it'll make it easier for you to see it, okay? So the first one says afferent arterial. We remember these words afferent and efferent, yes? Afferent is going in, efferent is out, okay? So if we trace your finger closer to where the glomerulus is, the bottom one here is the afferent arterial. It's going into the glomerulus. The top one is the efferent arterial. It's exiting the glomerulus and joining with the peritubular capillaries, okay? So this one is afferent. They're afferent arterioles. They're both arteries, okay? So you're going to have high pressure fluid moving through the glomerulus. Some of it will make its way into the tubule, and some will leave and rejoin the circulation through the efferent arterial. The efferent arterial joins the structures that are laying over the tubule called peritubular capillaries and will rejoin the general circulation, okay? So you have afferent, efferent, okay, going in and exiting just the glomerulus. Every glomerulus that we have has its own afferent and efferent arterial. Okay, the glomerulus is red. It looks like red spaghetti, okay? You can see it much bigger on this model. Same coloration, red spaghetti. That's the glomerulus, okay? This is a ball of capillaries that acts as a non-selective filter. So this is the afferent arterial. You come into the glomerulus, filter, filter, filter. Efferent arterial takes anything that's not going into the tubule. What's left over will move into the kidney tubule for selective work, okay, to make urine. Okay. Bowman's capsule is purple. It's covering the glomerulus. So if you look at this side by side, in this one, the glomerulus is exposed. The Bowman's capsule has been cut to show you the inside. But on this one, okay, it's kind of like a purplish color. Bowman's capsule is intact, okay, to show you what it would look like, okay? The glomerulus is inside this capsule. It's stuck in there, okay? So this is Bowman's capsule. What's inside is the glomerulus. The coloration is the same. here, okay? The purple, these cells, this is Bowman's capsule. What's inside is the glomerulus, okay? It would be completely, in a real nephron, this would be completely covered over with tissue, like a cap, okay? Okay. The proximal tubule on these models is pale green, okay? So you start at the glomerulus and you wind your finger through the proximal tubule. Okay, it's like a pale green. You go down this side, okay, of the loop of Henle. What is this if you're descending? Descending limb of the loop of Henle. You have to write the whole thing. Okay, so you have glomerulus, proximal tubule, which is the lighter green of the two tubules, continues on to the descending limb of the loop of Henle. You loop at the bottom, loop of Henle, and then we're going to ascend back up. So the darker green of the two is the ascending limb of the loop of Henle. This will lead way into the distal tubule. Okay, proximal means it's proximal to the glomerulus. Distal means it's distal to the glomerulus. The distal tubule will then join this long white tube. That's the collecting duct. Okay, the collecting duct looks like a branch on a tree with nubs coming off of it. Yes? Each of these nubs is where another nephron would be attached. So you will have multiple nephrons attached to a single collecting duct, okay? So you'd have one here and here and here and here and here and here. This whole thing would be taking place inside the renal pyramids, okay? If you cut the renal pyramid, this is what you're going to see, okay? Oh, peritubular capillaries are the red capillaries that are laying right on top of the tubule. It looks like little weird spider webs that are laying over the tubule of the nephron. Okay? So we have afferent arterial, glomerulus, efferent arterial, proximal tubule, descending limb of the loop of Henle, ascending limb of the loop of Henle, distal tubule, collecting duct. Just outside of it, the red spider web is peritubular capillary. The purple covering is Bowman's capsule. Okay?